Just bear with us for a moment. That's brilliant. So it looks like we have an additional panel member that we didn't plan on. That's all good. Okay. My name's Dan. I'm an academic at the University of Leeds. I have data analytics in my job title. I won't give you my job title, it's silly. But I've been, asked, and I have the privilege here of bringing together a number of speakers who are going to talk to us about digital and data and what sort of related technologies, what they can do in Bradford, hopefully to produce meaningful change for children and young people. As a little bit of background for me, I guess, up until about a year ago, I was involved in this work, but over the past 12 months, I've worked quite a lot with Kuldeep and the Connected Bradford team, and seen a lot of really amazing stuff and all the work that they're doing to sort of bring data sets together and think about new insights that might be derived in ways that weren't previously possible. I have with me six panelists. I did have five. I have the details of 5 panelists. So I'm going to have to apologise. It's Marianne.
I'll do myself. I was asked to step in for someone.
I'm just apologising for me in that I have everybody else's affiliation. We'll blame Mark, I think is the answer to this question. So I have 6 panelists with me now. I'm going to go through them quickly, give them all a little brief introduction. Then they're going to pitch their vision, their 2-minute vision for what they think data and digital can do to transform the lives of young people in Bradford. So our first panelist is Dr. Faisal Mushtaq. He's a cognitive neuroscientist at the University of Leeds and also Associate Director of the Centre for Immersive Technologies. We then have Kuldeep Sohal. She's from the Bradford Institute of Health Research, where she's the Programme Lead for the Connected Bradford Research Database. Third on my list is Professor Adam Glasser. Adam is Professor of Paediatric Oncology and Late Effects at the University of Leeds as well. Fourth, Adam, put your hand up. Adam Crawford, also from the University of Leeds, where he's co-director of the new ESRC Centre for Vulnerability and Policing Futures. Number 5, Tim Rogers, founder and director of Future Transformation, a values-led social enterprise in the data and digital space. And then finally, Marianne van der Brie from Cardiff University. Everybody's going to have a chance to introduce themselves, do a much better job than me, but I am reminded that I was supposed to tell you that lunch has started. You're not allowed to leave now, and I've said that. I'll see you later on at lunch. I'm going to do it. So I guess without further ado, because we're limited for time, we're going to start with these visions. As Adam did a great job previously in chairing the previous session, it's really important that when you listen to what these guys have to say, that you're starting to think about, potential questions that we're going to ask them. Where we get utility from an event like this is hearing your perspectives rather than ours. We're constantly nattering onto each other probably. So we really want you to think about what you want to ask these people, what this opportunity you've got here to talk to them. So with that said, we'll start with you, Faisal. Do you have a microphone?
Yes. Okay. Hello everyone. So this is working. You say yes. So Faisal Mushtaq, so I'm an associate professor in the School of Psychology at the University of Leeds. My research background is in learning and skill acquisition of sort of a wide range of sort of applications. For about the last sort of decade or so, I've been using the Born in Bradford platform that's been created sort of here in the city to answer fundamental questions about learning and skill acquisition and ultimately informing some interventions downstream. So we're talking about sort of vision now for sort of a few years. I see the platform, the sort of connected data sort of infrastructure that's been created here in the city, led by sort of Kuldeep and so many others, as sort of pretty unique across the UK, across the globe. When I speak to colleagues in the US, they're really envious of this sort of ability for us to be able to join the dots from various different sort of services and organizations together. And I'm thinking now sort of what sort of additional sort of data or additional sort of platforms can we sort of augment this sort of infrastructure with to be able to answer some important long-term sort of questions. So some of my work has been on using sort of state-of-the-art sort of technology, including virtual and augmented reality, and also so there's we have a store, in fact, sort of a plug for you to go check out, and also neurotechnology. So as a sort of background in sort of psychology, I'm interested in sort of brain processes and what that can reveal about learning and sort of impairments. And just yesterday, I was trying to get a photo up, but I'll see if we can get that up later on. We went into a school, Westminster Primary, yesterday, where we were recording brain activity for the very first time in the classroom. And the idea is to be able to map that on for long-term sort of understanding of various issues. These children are 10 and 11 right now, and we're thinking about sort of dementia, Alzheimer's, and sort of what are the sort of predictive sort of factors for that. And that's only possible because of the data that we already hold, and we can augment that with sort of these new sets of data from VR, AR, and sort of neurotech to be able to understand sort of with a level of detail that just isn't possible anywhere else in the world, I don't think, right now.
Brilliant. Thanks, Faisal. Okay, we'll hand straight over to Kuldeep. So I think that's the order of the slides, which I'm sat in front of.
Thanks, Dan. So I'm Kuldeep and I work at the Bradford Institute for Health Research, and 6 years ago I was asked to be able to connect to Bradford. It started off as a vision, it is a reality now, and I guess the next part of the vision really is now to how we can use that data, transform that, use that data to affect change, to improve lives across Bradford, improve employability skills, education outcomes and health outcomes. So that's really my goal and my vision really for the use of Connected Bradford now. That's me done now, Dan.
Brilliant, brilliant. Well, there's more time for questions. So the third person on my list is Professor Alan Glasson.
Hi. So I'm a paediatric oncologist. I deal with young people with cancer. So I come from this kind of quite an applied background. I can tell you that for non-white children born in Yorkshire, there is a significant survival, 20 years ago, there was a significant disadvantage in survival compared to a white child. We know that in the last 20 years, using our data, our outcomes and survival data, we know that the survival figures have improved for the non-white population, and then that gap has got better and better. But that's a slightly too simplistic statement. Actually, there are differences. There are different types of cancer. Some of our South Asian community do much worse than the South Asian child who has a different type of cancer. So we need to be a bit more sophisticated in the way we look at our data. It's not just looking at what's your ethnicity and do you survive. So we need to have some quite complex data in order for us to actually get the information that I need in my day-to-day practice and what we need across the whole economy so that we can also these inequalities. But it's not just cancer. Most recently, we've just picked up that if a child born with congenital heart disease, the relative risk of dying if they're non-white is twice that of a white child in Yorkshire. Okay, so the risk of early death is twice for the non-white child. Now we need to look into that. It's clearly an unacceptable issue, but it's not going to be a simple fix. We can't just look at health records. What I need, and what my colleagues in the university and the academic world need, is connected data. We need data from multiple sources. Someone in the earlier session talked about the criminal justice system, for instance. Now, it's not an obvious natural fit getting the criminal justice data and combining it with health data. But I think that if we want to really learn the lessons to improve health and health and well-being of our children, and if we improve the health and well-being of our children, we improve the health and well-being of the next generation of our society. What we've got to do is be rather sophisticated and intelligent and take what is really fantastic, which is the data that we have in the UK. So there are lots and lots of problems in the UK, but actually we have masses of routinely collected, very high quality administrative data on a whole population basis. For those who are teachers here, you know all about the National Pupil Database. It's fantastic. There is a wealth of information which is incredibly helpful to health service researchers. But actually there's a block. So for those of you from the Department of Education who are here, you may think you've got the data and you may think we're using it, but actually there is a massive, massive block. Now, Kuldeep's done an amazing job she's actually unpicked that and unblocked that blockage for Bradford. When we try and extend that, not very far away, just down the road into the rest of West Yorkshire, to get that data in Leeds, we can't do it. We go through the same processes. And something's changed in the governance arrangements in the Department of Education, and there's a block. There's something called the Data Sharing Approval Panel, the DFE, for those of you who know. And actually, we can't replicate what Coldy and Mark and all of you in Bradford have done with Born in Bradford and Connected Bradford. And so my ask is that we unblock this block, that actually we are a bit more connected at quite a high level. And we will be able to realise the amazing potential of big data if we are joined up and connected in our approach. And I think that absolutely needs all of us, whether it's those of us at the kind of grassroots level as teachers or doctors or nurses or physiotherapists or whatever, actually working with the research community, but also working with the policymakers. Because there's a block in local and central council to enable us to get access. And I can see other people around the room who are in Bradford influence nodding at this. So my big wish is that let's get together, let's build on what's been done in Bradford and what's celebrated today to make sure that this doesn't become an example that's like a David Hockney Museum piece. It's not locked away, but actually we can all have it in our front room and we can all benefit from it. So that's my answer. Thank you.
Thanks, Adam. That's great. I'll hand over to the other Adam, Professor Adam Crawford.
Thanks. And building on largely that, what I'll do is I'll start off with the vision, which we were asked to address, and then maybe say something about how I think kind of what I come to it. And so the vision, going back to what Anne-Marie Canning was saying in her introductory talk today, was about knitted data. And I think the vision is to use the unique opportunity that Bradford has and the work that's been going on over many years in building up the Connected Bradford database, to use that to engage in a much wider refashioning of public services and to think about the connections across and between the public services, because too often public services have remained siloed in terms of their particular working and the way in which they address issues and problems. And coming at this, as I do, from a background of research into policing, and that's been already raised by Adam here, it seems to me that yes, there is a challenging connection around the data, but it's also some real opportunities to think about the implications for the way in which different services, because just to take policing is often a last resort, but increasingly in terms of some of the multiple deprivations and vulnerabilities is drawn into a first position in terms of service provider. And thinking of the way that police connect up with health, with education, etc., I think there's a real opportunity to do something really profound within the Bradford area, working with stakeholders and communities.
Thanks, Adam. If you just pass down, Tim, go.
Yeah, thank you. I just want to build on that really a bit more and say that obviously we can use all this great data to help us make better decisions and to improve Bradford as a place. But I think we also need to involve businesses with it as well, and the employers and the future businesses that are going to be here. You know, we are the youngest city, very entrepreneurial city, and if we can provide that right environment to support those young people to create those businesses that are going to be the wealth creators and job creators of the future in amazing jobs that perhaps we don't even know exist right now, I think we'll start to shape Bradford a lot better. And with that extra wealth and that extra creation, we will see the difference that will make in things like health and education. I mean, there's no getting away from it. If you cut public services, you get worse public services and you get bad outcomes. That's just obvious. So we have to try and come together more and be really, really cohesive and unblock those blockages that you say. And I think the corporate world has really got to step up and be a big part of that.
Thanks, Tim. And our final panelist's vision, Marianne.
Hello, I'm Professor Marianne Vandenbray. I'm not from Yorkshire, I'm in Wales at Cardiff University. I've really enjoyed being here today and seeing what has been accomplished here. And I can only look at Wales and hope that we can learn a lot from what is happening here. I work on the Born Bradford data set. I work together with the investigators on it, as well as with a number of other very large data sets with linked data, electronic health data, the National Pupil Database, to look at the development of mental health and physical health together over the lifespan, and to try and identify in early childhood the risk factors that mean that those young people are more likely to develop depression and anxiety disorder and cardiovascular disease and diabetes later in life. But I'm also here, and I think Mark asked me to be on the panel because one of my other research areas is children with rare genetic conditions, which each individually are very rare, maybe 1 in 5,000, 6,000, 10,000. But combined, they are about 2% of the population. And we particularly study rare genetic conditions where the children have a very high risk of psychiatric disorder. 80% of the children we've studied have at least one psychiatric disorder. And there are also issues with developmental delay, intellectual disability, and then the increased risk again of cardiometabolic, cardiovascular disorders, diabetes in later life. And time again, the parents of the children in our studies tell us no one understands what this genetic condition is. The schools don't know, we need to explain, the doctors don't understand. They don't understand that it comes with sometimes 120 different aspects of health, physical and mental health and other issues. And these are difficult to help. The families are really struggling. It's difficult to help these children, but we know when they are born and they get their genetic test, when they're 1 or 2 years old, we know of the very high risk later in life, but not much is done with that. And there would be such a great opportunity for very early intervention for these children, but it's not really happening at the moment. And again, I guess then when we are linking up services and all the information, the children go to the doctor, they struggle in school, there may be social care issues and so on. It's not linked up and the children are not being helped at the moment. And that's why I think Mark asked me to be here to talk about this today. Thank you.
Thank you, Marianne. Look, I think, already some really inspiring visions here to sort of think about what change can really be made. And I'm quite happy to open out to the audience, but as ever, as an academic, I probably do have a question to, I suppose, get the ball rolling. So I think for a long time, we've obviously heard organisations talk about how they should have talked to each other more and there should be more data sharing and all of these organisations are siloed. But it feels to me like Bradford is sort of in a position where there's this tipping point, where we've built sufficient momentum. And I think that's around this idea of the Connected Bradford database. And I don't know how much the audience are really aware of what we're talking about. So I think I'm looking at you, Kuldeep, a little bit. But maybe could you tell us a little bit about what really is unique about Bradford in this sort of connected data set space?
So when I started 6 years ago, my boss, John Wright, asked me to develop Connected Bradford. And it wasn't called Connected Bradford. He just asked me, I want all the data from all over Bradford. I want it all linked up and I want it hosted at Bradford Hospital. So they didn't specify what data that was, they just said all the data from every single organisation sitting there. And they pointed towards the hospital. And he says, I want it all sat there, really securely. And I was like, ah. So I started off with GP data. And I think the conversations that we've had and relationships that have been built already because of Born Bradford with GPs and CCGs and senior stakeholders across the region and the local authority help sign off those early data sharing agreements. And obviously, one of the key concerns that came out of it right at the beginning was, well, how do we know you're going to keep our data secure? What steps are you going to take to keep that data secure? So the very first conversation I had before I even went to any of the GPs or anybody was go to the ICO. We had guidance. I was really fortunate enough to get a lot of guidance from an information governance consultant, Claire Sanderson, at the time. And we looked at all the different options and we went with one option and drafted out the specification, and the ICO were actually really keen for us to sort of put that vision into place. And in fact, actually, at the time, one of the things that they kind of noted in the data sharing agreement was, well, actually, how are you thinking about, this is research data, this is potential data that we use for secondary use analysis, but how could you operationalise this data? And I said, I don't know what platforms we're going to use to operationalise that database. But he said, we'll write it in anyway, make sure it's in there. You can figure that one out later. I'm still figuring that one out. Anyway. But so we have healthcare data, so we have primary care data which comes from GPs. We have hospital data that comes from Bradford hospitals, Airedale, comes from Calderwood as well, because some of our Bradford residents will drawn to the Halifax region as well. We haven't got Leeds Hospital data yet, but we will do soon. That's on the cards. And we also have other data sets, including community care data, which is held by Bradford District Care Trust. But one of the things I really wanted about 5 years ago was thinking about, well, how the healthcare data, we know that it exists in pockets across England anyway. But what we don't have is the wider determinants of health, because we know that has an impact on the individual's health and well-being. And so how we will link to education data now, Pauline Bradford was obviously the pioneer in linking health and education data for the Pauline Bradford participants. But my goal or objective was trying to figure out how to link those two data sets, which is something that Adam's still working on as well, but was to link those two data sets together. So that journey actually started 5 years ago with me as well, but we did get to that point with a lot of help and a lot of applications. So there is education data, and we've also been fortunate as well to get some anonymised crime data that's going to be used as part of Dan and Adam's work as well, and some housing data as well, because we know that housing and health have direct correlations. Recently, we've been the local authority shared some environmental data. I haven't got any information on that at the moment, but there was some information yesterday that one of the analysts has been working on, sort of plotting air pollution data and across Bradford, and then what we're hoping to do in the next big is looking at health outcomes as well with that air pollution data. But there's a wealth of data in there already. But there is some data that we still don't have, which we'll be working on as well. That's including the Leeds Hospital data. Does that help, Dan?
That's very helpful. I hope the audience thought so too. I think I wonder whether John really sort of anticipated the ask that he came to me when he said, let's bring all this data together. Because it's impossible to overstate how much work has gone into navigating all of the information governance and so forth that's necessary to do this. I really do think that we are in an incredibly unique position. I've seen people talk about doing this forever and have never actually seen the data. So on that note, I guess if there's anybody else who wants to mention any specific research that could sort of demonstrate the utility of working with that data, Faisal, you look like you're up for it. You can tell us, how is that data transformed outwards? What are people doing with that data?
Yeah, sure. So actually, this segues on from the earlier panel, if you were to attend that. And sort of very early on in that sort of case that Brody sort of describing about sort of 5 years or so ago, we wanted to demonstrate that it seems obvious now that actually connecting the data sets together will be advantageous in some ways. But you need concrete examples of how is that actually transforming sort of policy. So one of the examples I was sort of tangentially sort of involved in was on the sort of rates of autism diagnosis across the city. Now, autism by definition is sort of there from birth, but actually diagnosis can happen at any sort of point in that sort of child's sort of early sort of years. And we wanted to see whether the variance, sort of the differences at the stage in which sort of these children are diagnosed with sort of autism is sort of can be predicted by sort of various different sort of factors. And so as Chris in the last time was talking about, early interventions is absolutely sort of key to everything. And what we found by sort of linking, very sort of simply linking sort of health and education sort of data together and asking that question of which of these sort of various sort of factors that we have in our database can predict autism sort of diagnosis, we found, very interestingly, that the mothers of the sort of children who had A levels had children who had sort of twice the sort of rate of sort of ASD, sort of autism, than those who didn't, which is peculiar, right? So what was sort of driving that factor? And you start digging through the data a little bit deeper, and you start to understand, well, actually, those children who have mothers who sort of A levels know how to navigate through the sort of system much more effectively and more sort of confident in being able to do that sort of process. And that's what's sort of driving these sort of differences. We then went and sort of trawled back some sort of data, looked backwards and said, okay, well, now that we know sort of these children are getting diagnosed at this sort of particular sort of stage, and the differences were, I think sort of 4 to 5 years sort of differences between sort of these children, early diagnosis and sort of later. We then said, okay, well, what data do we already hold in the sort of system that can then sort of predict that? That's beyond that sort of, that doesn't have that sort of inherent sort of bias in terms of what opportunities that the mothers have had, the education that the mothers have had. And we found there's something called the Foundation Earlier sort of Profile Score that all the children across the sort of city, across the UK, have completed on them. Was a really powerful predictor of later sort of diagnosis of autism. And that is something that I think I'm not more involved in that sort of line of work now, but that sort of program is sort of scaled across the sort of city and sort of nationally, I believe now, sort of trials where you can sort of take these sort of these data that are coming in routinely sort of collected data can then be used to sort of inform sort of services to then get educational psychologists out there and sort of use those rare sort of resources, precious resources of educational psychologists and target those children for sort of these risk factors indicated by these sort of surveys. So I think that's been one of the real sort of success stories which has demonstrated the value of linking to then ultimately improve sort of life outcomes for children. And we're tracking those children sort of obviously ongoing sort of work.
Brilliant. And I think it's a really good example of sort of two-step process there, isn't it? Sort of understanding the context of, well, why are these individuals coming to the attention? Well, actually, it's because of the different structures in their households, and then using the data in a way to sort of prospectively move forward and engage in that upstream prevention, or upstream engagement. So I'm quite conscious that we everybody probably wants to eat some lunch at some point, but also I want to give you all the opportunity to ask questions. So if anybody wants to start putting their hands up, I think there is roving mic people. Someone must have a question. Definitely. Lady in the front row there. We got a mic.
I can just shout. Is social care data connected as well? That's it. I just wondered if social care data was connected as well to the other stuff.
Yes, it is. Yeah, there's adult social care. So one of the things about connected Bradford is it's the cradle to death database. Yes. So it has adult social care as well as children's social care data in there as well, and looked after children's data, which lends itself to developing something as part of the work that Dan and others are looking at is a vulnerability index to better identify children at risk of vulnerabilities and how we can sort of use that data to improve those kind of outcomes across Bradford as well. But yeah, no, it's in there. Thank you.
Can I just ask one more thing? Sorry. Are there any examples of this joined up data, apart from Born in Bradford, that have been case studies, if you like, where the joined up data has been used to support families?
At the moment, the data has been used for specific research questions. So there are a number of questions that are being explored by various analysts, but we haven't actually got to the stage about it. To support families is the next stage, which is where we operationalise that data, and that's part of my vision that I'm working on, kind of like the next phase of how we can go about doing that. But yeah, that's a plan, that's a vision though.
Sorry, that's question number 3, but it's because I'm head teacher at 2 Bradford maintained nursery schools, and so we work with the children at 5, and I wondered if the 2-year-old check data was used at all. It's a health check, but we also do it in nursery schools. So it comes way before the foundation stage profile data, and if that would be useful. But it's because I'm a head teacher at two Bradford maintained nursery schools, and so we work with the children birth to 5. And I wondered if the 2-year-old check data was used at all. It's a health check, but we also do it in nursery schools. So it comes way before the foundation stage profile data, and if that would be useful.
I think that's in the community health data. I'm looking at a couple of the analysts over there, so they'll be looking at some of the data. I think that's in the community health care data, but we haven't, which is still being cleaned up at the moment, but I think it's in there though. I know Pauline Bradford's done some work on that too. But yeah, if the data is recorded, then it's there, and then it's the next stage is for us to sort of, to use that data. So yeah, there'll be plans to do that work as well.
Brilliant, and let's hope we can be involved. I would really love to be. That'd be great.
Yeah.
That sounds like a conversation for lunch, doesn't it? We can tee up another research study. I think Adam had a comment to make.
So I just want to follow up on that. So we haven't used the Bourne and Bradford data that way, but Professor Feldbauer, who's an epidemiologist sitting in the audience, and one of our research postgraduate students is looking at social outcomes of cancer at the moment. We'll extend it quite quickly if we can and leads into other areas I mentioned, congenital heart disease. So we're working with our local charities, an active cancer charity, Candlighters, who support families around Yorkshire who are dealing with young people with cancer. And so we agree and they agree that actually we've got to have that linked social and education and health data. So Candlighters are certainly working with us now to see if they can target their interventions in the areas of greater social need and using this combined data. So we think it's quite an exciting opportunity. I don't think any of us use the data that optionally yet, because I don't think we've got access to the depth of data that's there. And everyone's very possessive, so you will be very possessive about your data. And we protect it, we have to protect our data. I want my data to be protected as a member of the society and the public. But in being protectionist, you will be cautious about uploading data from your register onto other data sets. But in being cautious, we're putting in huge blocks, and it just needs a bit of tweaking, because you can see the potential in your area. Everyone sitting here knows the potential. And I just think we've got to somehow shift slightly, have a mindset shift or shift in our focus. So how can we unlock the potential? We don't necessarily need more data. We need to use what we've got very effectively to support you.
Thanks, Adam. Any more comments from the panel on that one? We can move back to the audience. More questions? There's a gentleman in the on there front.
Hello. Yeah. I think I want to ask the question, but I just want to illustrate a little bit. In fact, if I got this wrong, then I apologise. I think that the clean air zone in Bradford is an amazing thing, and I think that that's probably come from the data that some of you guys have been looking at and crunching and all of that. It saddens me that we've got politicians who are trying to stop that happening, and it's been delayed for so many months and all those things. And when I see all the taxis driving around and they're now all hybrids or whatever else, I just think that must be incredible, because that must be making so much difference to actually the quality of air and how that's going to change the health of people in Bradford. And I don't think that the reasons behind why we're doing it have been communicated. I'm not saying it's anybody's particular responsibility, but communicated to this word Bradfordians so that they understand why that's happening. And I think that there needs to, in the earlier panel, there was this thing about, well, whose responsibility is it? And actually, I think it's that thing about it's the whole village, or it's the whole city. Every child's upbringing, their cognitive development is everybody's responsibility. And when you listen to the young people at the beginning, one of their asks was being communicated with and being told the reason behind. And actually, I think if we've got significantly important data to share, we need to share it with the communities So just recently, and I might be quite naive in this, and I understand there might be some pitfalls. Just recently, we were at a Homewood meeting, and there was a thing about Homewood having a very, very neurodiverse population. And actually, do they know that? And if they don't know that they've got this hugely neurodiverse population, it's all very well for the educators and the academics to know it, but they need to know it themselves, don't they? Because they need to know the reasons behind it. And then if they can have some control, if they get some control, they can take some responsibility. Is there a move to start sharing this data so that people, the population, can understand and benefit from that?
That's a really great point. So in fact, it's interesting you mentioned Homewood. You might well be aware of some of the work that's happening in there, working with the community to sort of generate new data and to help them understand what we're doing with those data. So it's a project funded by the Alan Turing Institute, which is just coming to an end now, and we're sort of moving on to the next project with Homewood. There's an approach, a sort of a philosophy that we're sort of adopting within this sort of this program, which is place-based working. So working within a specific sort of locality, a specific sort of community of people, and getting them on board. So within Homewood now, the last couple of years, we've had some engagement with all the sort of relevant sort of stakeholders and going into sort of schools and sort of explaining what we're doing with those sort of data, and why we're collecting those data and what they can be sort of used for. But it absolutely has to be that sort of way. We've got to engage with sort of with the people with whom sort of data we sort of hold. In a sort of broader sort of sense, this is where the Age of Wonder, which is the next sort of program of work following sort of as part of the Born Advanced and Longitudinal Study, there's a sort of citizen science element of that, and it's sort of engaging with sort of children from across the whole sort of city, getting them to generate new data, helping them collect, getting them to help us collect new data, and getting them to sort of tell us what they want to sort of investigate, what are the sort of questions they have. So the example just yesterday when we were in sort of Westminster Primary School as a sort of a pilot sort of case of what this could look like, we ran a workshop with our sort of 3 forms and said, hey, look, we're going to be collecting brain activity data. What do you think we should use that data to sort of ask? What sort of questions are you interested in? And yeah, because at the end, once we've collected all this sort of data, we'll come back and we'll sort of explain to them, hey, look, these are the sort of relationships that we've sort of identified. And that's got to be the way that it sort of works. And it addresses some of the sort of challenges, I think, that Adam sort of mentioned there, those sort of concerns around sharing those data and what they're sort of used for, and perhaps can be a way of addressing some of the sort of blockages that are in the sort of system. Is there anything else?
Anybody else? Marianne?
I was just thinking briefly, sometimes we collect material or information that the family isn't aware of, like high risk or presence of ADHD in a child. So a short report that is shared with the family and maybe with the GP so they can seek further help for the child. It's something we do, and it's probably also helpful in other studies.
I really like the idea of doing outreach work for skills around data. So what do we use it for? How do we use it? What do we want to see it for? And then when you are in these communities and you get this information back and you're sharing that back with them, this is an opportunity then to improve skills at the same time. So data analytics, data visualization, all that sort of stuff, where there's going to be a lot of jobs to do that. So following that pilot that you did in Westminster Primary, when you start to engage those young people and they're collecting their own information and then they get it back and they're like, random numbers, how do we make sense of it? And you talk them through these steps and these processes, you do create those citizen scientists, and we create more responsible citizens as well. And that would then help. And on the point about messaging and communication, for me, that's just got to be improved across the board. And you're right about that. There's no doubt about that.
We're going to pass. There are multiple mics in front of us. We're all experts. Do any of those microphones work? Okay. Before we get another question, I think have you got a comment?
Just very quickly, just we talked very briefly still just on sort of cooperation versus statement, and this is what sort of differentiates us from Facebook, Google, and so on. Again, you have enormous amounts of data on us, on us as a sort of society, and they use it in ways that are sort of not obvious to us. It's our responsibility to sort of work in a sort of more transparent way.
Couldn't agree more. There's a lady there at the front. If there's another mic, could you please introduce yourself? Just say where you're from, so that we sort of have a bit of context. Thanks.
Thank you very much. This has been a fascinating discussion. My name's Kate Orvis. I do a variety of things. In part, I lead some policy work at a policy institute with respect to global genomics. And I think what we're talking about here about data access and data sharing is really interesting and important. But that's a subject for a different time. I wanted to ask, what is it about Bradford that has enabled you to do something that the whole world wants to do and yet can't do it? So is it genuinely one person? Because we need to bottle this lady and export her from Bradford, okay? But there must be, genuinely, is that the answer? Because what you do...
We all want her. I tell you, if we can have her Leeds, I've got the Leeds Hospital charity rep here, she wants Cool Leaf, I've got the chief executive here, we want Cool Leaf. We all want Cool Leaf because we try and replicate the methodology and we can't get it.
And is this an issue then about Cool Leaf's cultural awareness and ability to come at issues? I don't know, what is it? Because the whole world needs to know this. I'm just putting it out there.
I'll write it up.
Look, I think it is. I think it's been amazing what Cool Leaf and John and Mark and the executive around Born in Bradford and Connect Bradford have done. I think everyone actually at top, whilst I'm being a bit having called to arms here, every time I open the door, get the microphone in my mouth. I think everyone at the top level knows we've got the data, everyone knows the power of the data, and everyone knows there's a blockage. I think that John and Mark and Cool Leaf were very vocal and they messaged it very well and they communicated it very well to the right people. And I think that to me actually is what we've got to start doing again. And I think that's why this kind of event, it's been called a celebration event, but actually the good about it's not just a celebration, it's the beginning of the next chapter and the next series of chapters for all of us, whether it's air pollution, criminal justice or nursery education, whatever. And so I think actually they have done something very, very incredible. But at the same time that Cool Leaf's in post over 5 or 6 years, we've also got to remember the information governance arena has changed. So if we went back to 2013 with care.data and the debacle really that followed, the principles behind care.data when David Cameron and his colleagues tried to sell health data off and share health data, the principles behind it were actually quite good. It just wasn't marketed very well to the rest of us. But as a result of it, for years, we've seen shutter after shutter after shutter come down. And that's hindered things. And it's not the repercussions haven't just been in health, it's been in social care, in education, and in criminal justice. And I think we've got to invest the money to get us around the table and market it. And we've heard about marketing the neurodiverse issues and the air pollution. It's that common thing as well. The heart is there, but we know the intelligence and the underpinning justification is there. But we've got to do something to support us all having a culture.
Mm-hmm. I think it's just not like some objective bystander. I think the fact that Bradford did Born in Bradford has created a massive amount of public trust and engagement that you cannot do a programme like this if the public is not on your side. And I think that whole issue around informed consent and making sure that we've got the right, procedures and processes in place, but I have to congratulate you. I think what's happening in Bradford is extraordinary. So well done.
So I'm the chair. I'm going to chip in a comment. I think to what you said. I think that you're exactly right. But also, I think that we're now in this key place, aren't we, in Bradford, where we're going to have all of these brilliant examples of where, when you actually jump through these barriers, this is what happens. So the autism work, classes work, all of this other stuff is now, I think, the wedge really to use to say, well, we're not just trying to convince you this is a good idea. We have solid evidence of when you do this, the outcomes get better. And I think that that's our opportunity now to sort of shout from the rooftops a little bit about all the great work that Kuldeep and is enabling, and a lot of other people are doing. So I see Kuldeep is shying away a little bit, but genomics, we can, if that's how genomics works, right? We can replicate her, I believe. Okay. Okay, any more questions from the audience? Gentleman there in the very sharp suit.
Thanks a lot. I'm Ashu Chatterjee, Professor for Digital Health and Education at University of Leeds and Dean for Digital Transformation. I think just sort of, and going and comment first and then a question. We are doing some work with sickle cell patients in terms of trying to understand their data sharing perspectives, and some of the things that has happened in the past, which you just referred to, has sort of, I think, deviated the amount of confidence individuals have. So we need to do a very expansive, extensive amount of trust building exercise with sort of communities around, and in order to sort of explain them what the data is being used for and how it's managed and governed. And there's a risk. I think somebody mentioned about involving corporates. And again, if we do, there's benefits of scaling up the approach that we are taking by involving corporates. But the moment you start involving corporates, there is that added layer of what you're using the data for. And again, I think there's some previous bad examples of doing that. So that's a comment. The question here is, because we're talking about unblocking data and so forth, now that the integrated partnership through the Integrated Care Board as part of West Yorkshire is in sort of legal footing, do you see that as an opportunity to be able to join some of the dots? Because now, hopefully, with that sort of new Health and Social Care Act being realized, the board can make things happen across those 6 places across West Yorkshire, replicating what Bradford has done, but scaling it up. And sort of the question is that, do you think that is something that the board should be looking to do? And is there a blocker that you immediately can think of that might stop doing that?
Kuldeep, do you want to talk about Connected Yorkshire?
Yeah.
West Yorkshire.
Yeah, no. Initially, it's, I actually have 2 names. It's Connected Bradford and Connected Yorkshire. We do have data outside of Bradford, because the initial vision 6 years ago was to have data for our Bradford population, recognising the fact that our Bradford population, they live on the fringes of other regions such as Leeds or the Calderdale region, or so we recognised that we needed to have other data sets that weren't Bradford-centric data sets. So just to sort of mention the other data sets that we have in there, I mentioned that Calderdale Hospital data as well, which is the same data that we get from Bradford hospitals as well. The Yorkshire Ambulance Service data, which includes things like the 909 and 111 data, is still very much in its raw format, because the paramedics are helping us sort of clean that data up. But that data is for the whole of Yorkshire. It's not just for Bradford, because the vision was to develop this Connected Yorkshire database. So the vision is still there. And then I was just mentioning, I think, to another colleague as well, that some of our Bradford GPs that live in the Airedale region, and I approached them 6 years ago with data sharing agreements. They said to us, well, that's fine that you're going to go to Bradford Council and get the social care data, but what about our GP? What about our patients in our GPs? They go to North Yorkshire Council. I did start those conversations a few years ago with North Yorkshire Council. We have got some adult social care data from that was quite old, so it was a few years old, but we do need to go back and refresh it. But definitely, the vision is to have that wider Yorkshire data, including the Leeds data as well, to support Adam going forward. So yeah, there are ways and opportunities to do it. Probably, I just think it might involve a bit more cloning of me around in some of these regions.
We're working on it. So we have 2 minutes left, just over 2 minutes left. I'm going to shamelessly steal from the previous chair. And I think, we've talked about how we want to do this forever. So I suspect that you all as an audience have got lots of interesting questions which might turn into those case studies to demonstrate what the utility is. So now you sort of understand that we can do this in Bradford. What sort of questions would you like to be able to answer with connected data sets? Is there sort of burning questions, things that you've always wanted to explore? Again, as Adam said, I'm looking for my next 5 years worth of research projects. Gentleman over there.
Yeah, hi, I'm Daniel Ware. I'm a Chief Inspector Police Officer. As a uniform use away. Loads of stuff around harm prevention, I think. Adverse childhood experiences, ability to put in preventative measures around things like prevalence of domestic abuse within a household, where there's sibling engagement with the criminal justice system, where there's parental or guardian interaction with the criminal justice system, and all those complex life interactions that, as we're all sat here today, mean that disproportionately some children, through absolutely no fault of their own, just the circumstances they're built into, will either experience or perpetrate harm against others. And how we can prevent that.
So that's a giant program of research, which I believe Adam probably talked to. So in the break, any more questions? We've got 47 seconds left. Come on. There must be another one somewhere amongst us. The amount of time for this question is getting shorter, so it's going to be a more effective question.
How we can learn to reprogram from the Westminster data that you're getting, because there's children, like your children who are your children who are very deprived have like not a very colourful brain picture or whatever. I'm sure you can describe it better. What we're going to do about the children who've had the 2 years of deprivation extra due to COVID? How are we going to reprogram the children so that the connections can be reactivated?
Yeah, I think that's obviously a really important question. Faisal is going to meet you at lunch. So we have negative 7 seconds left. I guess I'd like to take this opportunity to thank the panel, some of which were sort of drafted in at the last moment because of sickness and so forth. So thank you very much for giving your opinions. Thank the audience. Let's give the panel a big hand. And now I am very happy to introduce the Hazelbeck Performing Arts Group, who I believe are still at the back of the room. That's a good guess, maybe? Yes? Brilliant. Okay, everyone, stick around. This is going to be a great performance, from what I've heard. Thanks, everyone.